Alberta's healthcare spending tops the nation, but are we really getting what we pay for? The Canadian Institute for Health Information tracks wait times and spending across the country. Their latest report is out this week, comparing the projected provincial levels of healthcare expenditures for 2017, and Alberta finished in second place per capita, spending $7,329 per person. Alberta was second, but that really doesn't tell the full story. In first place with the largest per capita healthcare spending was Newfoundland and Labrador, but they have a far less dense population to provide care for, which naturally increases the cost of providing that care. And as University of Alberta economist Trevor Toome points out, Alberta has a more youthful population, with only 12% of the population over the age of 65. Toome told the Calgary Herald that adjusted for age and gender differences across provinces, Alberta is by far the highest spending province on health, a full 14% higher. What this all means is that Albertans, comparatively speaking, are accessing healthcare services less because we're younger and healthier, but we're still spending way more. Now, this isn't exactly a new problem. In 2016, the Conference Board of Canada was sounding the alarm bells that Alberta already spends 33% more on healthcare than the rest of the country. And this wouldn't be so terrible if Alberta had 33% better outcomes than everyone else, but we don't have that either. Again, according to the Canadian Institute for Health Information in 2015, as reported in the Calgary Herald, Alberta scored below the national average for avoidable admissions due to chronic lung infections and diabetes. Alberta has a worse than average result for breast cancer survival, cervical cancer mortality, and colorectal cancer survival. The province even falls below average for post-operative infections. These are conditions where early intervention, early diagnosis, and early access to care can seriously improve outcomes. In Alberta, we even have a government website that shows how awful the government really is at providing timely care. I don't think it was meant to do that, but it does. For example, if you live in southern Alberta and need knee replacement surgery, your current wait time is approximately 71 weeks. In Alberta, only 58% of people get access to cataract surgery at the benchmark of 112 days. Imagine losing your eyesight and not even being able to access care for at least a third of the year. And that's the best case scenario for barely over half of Albertans. And Alberta has the longest wait times for life-saving MRIs in the country at 242 days. So Albertans are spending more, accessing healthcare less, and when we do need to access healthcare, the wait times are atrocious to the point where the outcomes could be absolutely devastating. Albertans spend roughly 46% of the total overall government budget on healthcare services. We are only going to see that number increasing as the years go on and our young population ages. And the NDP aren't done creating more healthcare costs for us. Rachel Notley's government has promised to renationalize private laboratory services by 2022, costing at least another $50 million immediately and creating 1,200 more government workers who used to exist in the more affordable, more efficient private sector. The NDP are also renationalizing hospital laundry services and making expensive upgrades to hospital laundry facilities instead of contracting out to readily available, equipped companies to save the taxpayer money. The problem is compiling year after year. It never gets any better. It started with out-of-control reckless spending in the good times that set a precedent for today's taste for waste. Then we had progressive conservative governments that were too timid to take on the powerful public sector healthcare unions. And now we have socialist governments that are beholden and sympathetic to them. With the sheer percentage of Alberta's budget that goes into healthcare costs, nearly half of every dollar spent in Alberta, Alberta's fiscal house will never be in order until someone is brave enough to tackle the sacred Canadian cow of the public healthcare system. For the Rebel.media, I'm Sheila Gunn Reid. Did you know I have a weekly show here on The Rebel where I bring you interviews with interesting Albertans the mainstream media often talks about but never talks to? To get access to my show and the rest of our amazing premium content, become a subscriber today.